Hi, I'm Dave Brown. Now that you've seen some of our current features, please indulge us as we show them in a clinical simulation. Notice that users are interacting with the application by voice. This allows them to actively move from patient to patient, free of the workstation tether. What you're about to see isn't science fiction. We've already built most of it, and we're just getting started. Enjoy.
Hi, I'm Arnold Ross, an ER nurse at Gotham General Hospital. I will show you how I can use the Quick Assistant to enter vitals in the EMR, change the patient's status, and send an alert to another care team member, all without even looking at a screen.
And I'm Rachel Thompson, an ER physician at Gotham General. I will show you how I can receive and respond to an alert, initiate and complete ambient encounter capture, enter orders, send a message to a colleague, and request a notification, all without using the workstation or fiddling with my phone.
Nurse Arnold Ross enters room C5, assessing a new arrival. The patient reports a cough, fever, and chills for the past week. Arnold checks the patient's vitals, then heads for the hallway.
Quick! Document a patient assessment for the patient in room C5. They are reporting fever, chills, and a cough for the past week. Their vitals are temperature of 102.3, blood pressure of 89/50, and a heart rate of 95.
Your assessment for the patient in room C5 is: patient is reporting fever, chills, and a cough for the past week. The vital signs are recorded as temperature of 102.3, blood pressure of 89/50, and heart rate of 95. Patient meets sepsis criteria. Dr. Thompson, who is signed in as the primary provider, will also receive this alert.
Dr. Thompson receives an alert.
Urgent message from Arnold Ross.
Quick, I acknowledge that the patient in room C5 is now on sepsis alert. I will visit him now.
With her phone's mic on the ready, she heads to room C5.
Quick, begin ambient capture for the patient in room C5.
Initiating.
Hello, I'm Dr. Thompson. Are you Mr. Davis?
Hello. Yes, I am. Nice to meet you.
It sounds like you've been having a cough and a fever for the past week, is that right?
Yes, I've had this horrible cough for a week, and the fever doesn't seem to be going away, even with the Tylenol I've been taking. I feel like it's getting a little harder to breathe, too.
That sounds concerning. Are you feeling short of breath when you're walking, or is it even when you're sitting down?
I'm feeling short of breath all the time, but it's worse with walking.
You also mentioned you have a fever. Did you take your temperature, or do you just feel hot?
Well, I don't have a thermometer at home, but my skin has definitely been hot to touch.
Your chart says you're 67. Have you had a pneumonia shot? How about your flu shot this year?
I have to admit, I didn't get my pneumonia or my flu shots.
Okay. Let me have a listen to your lungs, and we can order a chest x-ray and some blood work to make sure you don't have pneumonia or a bloodstream infection that would require antibiotics.
Thank you, Dr. Thompson.
Dr. Thompson leaves the exam room.
Quick, end ambient capture.
Encounter with the patient in room C5 captured and ended. Processing.
Quick, send a message to Arnold Ross.
What is the message?
The patient in room C5 sounds pretty sick. I am ordering antibiotics and IV fluids since their blood pressure is a little low, and we should check their vitals as soon as the fluids are done.
Received. Sent.
Quick, please order a CBC, chemistry, blood cultures, venous blood gas, lactate levels, and a portable chest x-ray for the patient in room C5.
Received. Ready for review and submission.
Dr. Thompson checks the Quick app. She checks the queued orders for the patient. After review, she taps Submit. Now that her orders are in, she checks the AI-generated encounter summary. Her final step is to edit and submit the final note to the EMR.